Wake that ass up.
Early in the morning.
The Breakfast Club.
Morning, everybody. It's DJ Envy, Angela Yee, Charlamagne the God. We are the Breakfast Club. We have a special guest in the building. She is the CEO of Connect Care. She goes by the name of Ginalisa Monterroso.
Good morning.
Did I say that right?
You sure did.
Okay.
Good morning, Ginalisa.
Hi, good morning. Thanks for coming.
Tell us about Connect Care Advisory Group.
Connect Care, we assist the elderly and the disabled in becoming eligible for Medicaid to cover nursing home, assisted living, home care. We also assist with guiding our caregivers on how to best plan for our elderly and loved ones.
That's important because people will drain their whole bank account, their savings, their retirement money just to be in a nursing home or to put a family member in a nursing home. And that's very, very stressful for us financially.
It's super stressful. And I think what happens is that when we are in a situation where we have someone who's disabled or elderly and there's a crisis and we need to kind of figure out what are we going to do? We're just automatically thrown into this situation and we don't know where to go, how to navigate the situation. And this is what our agency does.
How did you even get into this? Because we just had Megan Thee Stallion up here and she said she wanted to get into the assisted living field. How did you get into this?
Just by accident. You know, I my first job was working in Wall Street and it was a bit too crazy for me, and I would just be crying in the office. Men would be just smoking cigarettes and just cursing all over the place. And this woman was just like, look, Gina, I have a friend in a nursing home industry. She's looking for someone in the finance. Do you mind going? And I went, and it was in a nursing home. And to be completely honest with you, I was like, it's not the most sexiest job, right? When you're leaving school in your 20s to be working with the elderly. But what I did find out is that, you know, they bring so much to us and they paved the way for us. And,
Absolutely.
And they just walked a mile that we didn't walk. And it's a population that we really do not appreciate. And just working with them on a day-to-day, I learned to appreciate my elderly.
And we will be them one day.
We will. And
Absolutely.
You know what?
If we bless,
God willing.
Hopefully,
We will.
God
We will.
willing.
We will. And you know what? We actually educate everyone is that healthcare is such a big topic right now, right? And one of our main components that covers the nursing home and home care, assisted living is Medicaid and Medicare. And what I've learned is that Medicaid is such a dirty word, right? It's just when you talk about that word Medicaid, you think about poor and I don't have anything. Yeah, and it's a handout.
Right.
And what we fail to understand is that it's not a handout. That's our tax dollars, number one. Number two, under the Medicaid umbrella, there's so many programs specifically tailored to help us in the event that we need help. There's programs for pregnant women. There's programs for the elderly where you're able to preserve your income and your assets to qualify and stay home, and you don't have to go to a nursing home. And I think we as a community, we need to educate ourselves and not be afraid to say, hey, I need some help. Because that's what it's there for.
How can we educate ourselves? I mean, it's very difficult, and especially when you have to deal with it, it's usually quick. Like, for instance, my mother-in-law has dementia, and she was living in Queens, so we brought her here to New Jersey. And then I realized that a lot of things that she was eligible for in New York, because she lived in New York, she's not eligible for New Jersey.
Not.
So I had to pay a majority of that, which I'm fine with because I love her to death. But when she went back to New York, because it seems like the dementia actually was less when she was back in her surroundings and back in the place where she lived, she was able to get a lot more of the stuff that she wasn't able to get. And that doesn't make any sense, because if I have a family member that lives out of town, she doesn't get those same benefits because she's not in her home state. Like, it gets confusing.
It does get confusing, but you know what? Each state decides to opt into how much they would like to give to our elderly and disabled. You know, we're very fortunate here in New York that our elderly, there's so many programs. Obviously, New Jersey, as you know, doesn't have many benefits to assist with our elderly and disabled. And like you said, once she crossed over the state line, boom, automatically she had all of this service in place. And I think how we educate ourselves is ask questions. You know, we always plan for just the craziest things, right? We plan our wedding, we plan for vacations. You know, we plan for something, but we never plan for when we get old,
Right.
And when we get sick, or if a family member gets old and gets sick, and that's a topic that we really need.
When black
to
people
have.
plan, they say their kids are going to take care of them. That's what usually black
You
people
know,
do.
and that's another thing. You know, we're all taught that, you know, our parents are like, you know, when I get old, I'm moving in with you. and you're taking care of me. But we've been so warped into thinking because that's just, how we were just built to think, and it was brought into our ear. But there's programs out there.
Right.
There's programs out there that will assist you. It's not going to be perfect, right? We talk about everybody's just like, this healthcare system, it sucks and it doesn't work for me. But what we got to understand is that the system was placed to assist us. It's not going to assist us at 100% because you know what? You got to do your job too, right? You got to make sure that you go to your annual checkups. You got to make sure that you're planning for your elderly and disabled, and it's going to come 80%. It's not going to be 100%, but it's going to work for you. And each state opts into the program that they want to assist in. New Jersey's not really, the place, but there are programs that can assist the elderly.
Well, I want to thank you for what you did for me and my people.
Oh, you're welcome.
What was that exactly? What was the program?
So what we did was we...
I don't know. My wife handled all that.
And she's amazing. I love her. We applied for Medicaid, and with the Medicaid program, we have some daughters who are involved in her care, and we were able to put them on what's called the CDPAP program, the Consumer Directed Assistance Program, and that's where you can hire your own family member to take care of your elderly loved ones, because the elderly people don't want strange people in their homes.
And you're probably doing it anyway and not getting paid for it.
Exactly.
So now you're getting paid to do just that.
Yes, and Medicaid pays you pays the relative directly.
Oh, and let me tell you that. My mother-in-law used to think my nanny was the devil, was trying to poison her, wouldn't eat from her or nothing. But when she went back home, my wife's brother was able to take care of her, and he gets paid for it. And I feel way more comfortable knowing that there's a loved one taking care of her 24 hours, 7 days a week, and I'm happy with that. Now, how can somebody get into that program and find out more information about that program?
You have to be eligible for Medicaid once you qualify.
How do you how you become eligible for Medicaid?
That's a good question. So, when we think of it, we think we're not supposed to have any money. But here in New York, you can have up to $15,000 in your bank account. Nobody knew that. Everybody thinks you have to hide your bank account or hide your money in a shoebox. And you can have income up to $875 a month. Anything over that, you're still able to preserve all of that. You just go into the Medicaid office, you apply. It's always best to work with an agency who specializes in this, because there are a lot of different finances that people have that may just kind of slip you out and not qualify you. But once you're approved, you just tell them that you want your loved one to provide the service. They go into the agency, get screened, and they're up and running. The process is not an easy process.
No.
There's a lot of red tape that you have to go through.
Why do they make it so difficult?
Huh?
Why do they make it so difficult?
Because they're giving the money away, basically.
Yeah, you don't want people to also, how people always trying to scam something.
Yeah.
It's I'll be completely honest with you. I love my city workers, and they work hard, and they're overworked, and there's a big caseload. But I also kind of feel when it comes to the population of the able and the disabled and elderly, I think there just has to be a little more patience and guidance to guide them. Because can you imagine if you're sick or disabled and you're trying to get through the system and nobody's picking up the phone, or somebody's telling you no, and they give up and they just like lose hope and think that there's nothing out there. But I just think they're overworked, and I just think we as a city, we have it together. We just need to get it a little more together.
Right.
What do you think has the best health care plan out of all the presidential candidates?
None.
Really?
I'm be honest with you, I'm so happy you brought this topic of conversation. I think the candidates really need to get into what this healthcare program is. It's a good program, and we all want healthcare, and we all need healthcare. But there's just a bigger monster out there in healthcare, and that's our private industry. We have private health insurance companies that monopolize this whole system, and it's more about profit rather than taking care of our loved ones. And our healthcare is truly compromised, so these healthcare companies can make a profit. And I think each candidate needs to address that. If it's private, I'm okay with that, but we need to figure it out. Don't compromise someone who's disabled or elderly just because you need to put an extra dollar in your pocket. And each candidate needs to address that.
Are there any good plans out there? I know the Affordable Care Act.
The Affordable Care Act is a very good, when it was first put in place, it was it was a wake-up call for everybody because now everybody is aware of healthcare. Prior to that, nobody talked about healthcare, but now that it's gone, people are missing it. And each healthcare plan works according to your needs. And again, making sure you go to your doctor and taking care of it. It's not gonna, do everything and create these miracles, but it works. I'm not gonna say, which healthcare plan is the best because I think, there's room for improvement, and I think that's more on a federal level rather than the insurance company themselves.
What if you're undocumented? Is there anything that you can do, or is it just?
Well, you let out a sigh just now.
Undocumented is such a touchy subject. I think it's just been put out there as an ugly word, and there are benefits, and you can get emergency health care. And I know many people are against that. You come over here and you're not documented, and why should you be using our tax dollars? But what we have to understand that in New York, we are the melting pot. We are, this is what makes us, and this is what we do. And we shouldn't kind of discriminate just because they're undocumented. It's a human being. Right. It's a life, and, we need to just take
So what
care of
can
that.
you do if you're, so there are emergency programs?
You can qualify for emergency health care. It's only emergency.
Right.
I mean,
and that's probably scary anyway, because then you don't know if you'll get deported if you try to qualify for something, and
again, it goes back to, another word that's being thrown out there, undocumented, you shouldn't be here. They're walking around with their heads down, thinking that, they can't get care. But the scary part is, they may have something that they're passing around. And, just because, we're kind of tabooing them, they're not going to go out there and take care of them because, we're shaming them for being undocumented. And that's not good either.
How are your employees feeling about the coronavirus? And like you said, working with elderly and them being more vulnerable than anybody else?
Look, we can get any virus out here. It's just, anything. I think don't be scared, take care of yourself, wash your hands, and, just be vigilant in your surroundings and the cleanliness or anything. But, we still need to communicate. Right? We still need to speak to people. We need to just be out there. And it's scary. It's super scary. But you know what? We as an agency, we're not going to go and put fear out there to our elderly and disabled people because, we feel the coronavirus. We, wash our hands. We're walking around making sure that we're protecting ourselves. But, I know it's scary, but just live, though. Because it's just going to be uncomfortable if you're just worrying about somebody sneezing and somebody coughing. It's not good for us, and it's not good for our elderly and disabled loved ones.
I want to talk about your personal story a little bit, because you had a daughter who was born with Down syndrome.
Yes.
And you said the hospital provided you with no guidance or services for raising a child with Down syndrome.
I was in my 20s. I gave birth to Tara Monterroso. She's 24 now, and she was born with Down syndrome. And the hospital, which I will not name, held my daughter for 2 days, and I couldn't see her. And then finally, when I was able to see her, it was a bunch of doctors, and they were just like, "We are so sorry to tell you that your daughter was born with Down syndrome." And we have an adoption agency waiting to be sent her over there because there's other families that would want your daughter. And I'm just looking at them like, wait, where's the congratulations?
Wow.
She's healthy. What do I do? And, they were like, she's just going to have a very bleak life. Please consider adoption. And I was just hurt. And I was just disappointed. I mean, this is medical professionals that are supposed to help you. And I remember leaving the hospital with this wrinkled up paper with a referral to the New York's, the National Down Syndrome Society, and that was it. And I'm like, this can't be it. This can't be it. And I just started searching, looking for programs and just advocating. And I said, when we are faced with someone who's disabled and needs services or elderly, we're lost. And I said, I'm going to open up an agency to guide, because navigating the system is not easy. But what I do know is that, it's a sense of relief, just like, how we helped you. And we got in a place because we don't know where to go. And she's a blessing, and I love her dearly. And, her name, she's air. She's my air. She's my breath. And she's what keeps me rocking and rolling.
Wow.
We appreciate
how can they
joining us.
contact you,
absolutely.
Ginalisa? For anybody that needs any of these services.
Yes, our phone number is 646-745-9122. We also have a website, www, I said 3 W's, connectcareag.org.
All right. Well, thank you for joining us.
Thank you
today.
for
once
having
again, thank
me.
you for what you
Thank you.
did for me. Oh, coronavirus. Pound. There you go.
Pound.
But thank you for what you did for me and my family.
Anytime, we're here. We're here, guys.
Absolutely.
All right, guys. Thank you so much.
All right. Thank you.
All
It's the
right,
Breakfast
take care.
Club. Good morning.